There's been a lot of information about COVID-19. Much of it focuses upon the statistics and upon the biology related to the coronavirus. But what we're seeking to do in this series is to talk about some of the issues that lie beyond the biology. We have a website, cph.temple.edu/COVID-beyond, where you'll find more information about the series and where you can also submit questions. This particular seminar will be addressing the impact of the pandemic on people with developmental disabilities. I'm Philip McCallion. I'm the director of the School of Social Work. I'm also a professor of social work, and I have probably about 40 years experience working with people with intellectual and developmental disabilities. You'll see information about me here and the different kinds of things that I've done, but as well as a lot of work around research. I've done a lot around training, and also for about 10 years, I ran services for people with developmental disabilities myself. So the perspectives that I offer draw from all of those experiences. So I'm going to cover a number of things. I'm going to talk a little bit about some background on COVID-19. I'm going to talk about the implications for people with developmental disabilities. And then I'm going to talk about risk, the statistics to the extent that we know them to this point. I'm going to talk about prevention, management, and I'm going to deal with what is really has become a very troubling issue in terms of where should people with developmental disabilities who have COVID-19, where should they be cared for? And I'll talk about the issues around hospital versus in-home care. I'll talk about the concerns that are being raised about access and equity. And then I'm also going to talk about end-of-life care and the implications there. And finally, I'm going to cover for you a number of resources. This particular webinar and all the webinars will be saved on the site, will be accessible afterwards. And so don't feel you have to immediately write down all the things that I mentioned in terms of resources. That information will be available to you afterwards. So you've probably seen a lot around COVID-19, but let's just cover what I think are some of the sort of important issues that then I will return to as I talk about the implications for people with developmental disabilities. So it's an infectious disease. It's caused by a newly discovered coronavirus. So we actually, we were surprised by it. We didn't have a lot of knowledge or resources to be able to respond to it initially. Most people infected experience mild to moderate respiratory illness, and they recover, but there are some who do require special treatment. But it gets lost at times. We rightly focus in on the very high death rate as compared to some other illnesses. But it's important to remember too that most people it will be a mild to moderate illness. What we do know is that older people and people with underlying medical problems, and some of the medical problems that we've been seeing identified are certainly diabetes, cardiovascular disease, respiratory disease, cancers. They are more likely to develop a more serious version of COVID-19. I always think about that word more likely. I don't want to ever present this as it is an absolute, particularly as we think about people with developmental disabilities. Too often, use of language that is absolute means then that perhaps they're not offered services that they should be. So I will emphasize again, it's more likely. There are things that we could do that will protect us from infection. We need to be washing our hands. We need to be not touching our faces, and we need to be keeping physical distance. The first recommendations were that we stay 3 feet apart. Now we're talking about 6 feet apart. We do know that we're getting to know more and more about how the virus spreads. It seems to be primarily through droplets of saliva or discharge from the nose, and they get spread by coughing and sneezing. When we talk about wearing masks, I think that a lot of us, when we put on a mask, we think that we are protecting ourselves from others, but actually we are ensuring that others are protected from us if we have potentially the virus, because it is about the control of things like coughing and sneezing that will reduce the spread, and it's also about keeping surfaces clean, and really just avoiding contact. To date, there are no specific vaccines or treatments for COVID-19. It's disturbing to see some of the advertising of miracle cures. You know, this always happens when there's something major and new that comes up. There are a lot of ongoing clinical trials that are evaluating some potential vaccines or treatments. Some appear to be offering some promising evidence, but none's at a point where it's likely to be widely made available. But we remain hopeful that this could happen. So what I want to focus in on is who's at greatest risk. And again, I've covered some of this, but risk is influenced by things like age, diabetes, hypertension, cancer, respiratory problems, multiple chronic conditions. So what I want to emphasize on this slide is really two things. First of all, what's in red at the bottom. There's no evidence to this point that having a developmental disability is a risk in and of itself. However, when you look at the reports on the health of people with developmental disabilities, a number of these disease conditions do exist. The other thing that I think we need to be concerned about is this issue of age. In the general population, what we're seeing, it's not that there aren't reports of younger people with COVID-19, but the majority of people who have serious illness and the majority of deaths seem to be in those 70 years of age and older. It's not known for people with developmental disabilities, specifically in terms of COVID-19, but we do know that in terms of other disease conditions, that the profile of people 70 and older in the general population tends to occur earlier for people with developmental disabilities. So that a person with a developmental disability in their 50s or 60s, we should be equally concerned. In the absence of information that says that they are not at increased risk, because of our experience with other disease conditions, we should be concerned when a person with a developmental disability in their 50s and 60s presents with the symptoms of COVID-19. It's likely that it will be a serious disease for them. So I've used developmental disability a lot. A couple of times I've used intellectual disability. So let's just define some things. So the term developmental disability is defined in the Developmental Disabilities Assistance and Bill of Rights Act of 2000. It's a severe chronic disability in an individual 5 years of age or older. And I'll come back to what I just did. It's onset before age 22, and it results in substantial functional limitations. So it's not really a health diagnosis, it's about a functional limitation diagnosis. All of that said, however, we do know, there's a lot of evidence for this, that there is greater prevalence of a number of chronic conditions, and I've listed them here. Things like gastrointestinal disorders, respiratory disorders, particularly pneumonias, epilepsy, sensory impairments, dental disease, osteoporosis, dementia, and there are higher rates of mental illness and of behavioral challenges. So again, these are higher rates, greater prevalence. That doesn't mean that everybody presents with all of these things. But these are things that, as we look at the health of people with developmental disabilities, we're constantly looking at, we're constantly seeking to better manage. And for people with developmental disabilities today, a number of them will likely place them at increased risk for COVID-19. Some of this happens because people with developmental disabilities are more likely to lead what we would consider unhealthy lifestyles and not access health promotion or health screening. And that's not always because of choices they are making themselves, but sometimes it is. When a person has a developmental disability and perhaps has communication difficulties, we're likely to be relying upon other people to see my need and to report my need. And so that we've seen tends to increase barriers and the likelihood that health needs are not well identified. And if they're not well identified, then we're unlikely to, or we're less likely to follow up effectively. We see things like higher levels of obesity, a more sedentary lifestyle, that they participate less in physical activities, and they're more likely to consume high-fat diets. Again, some of that may be by choice. Some of that may be by people thinking that it's a nice thing to do to buy someone an ice cream. And it actually is a nice thing to do to buy someone an ice cream. But I think that as we look at what we're dealing with today in terms of COVID-19, and we look at the possibility that there may be subsequent waves of COVID-19, or that there may be other viruses that we have to deal with, I think there is a message for all of us who are working and doing research and doing training in the area of developmental disabilities that we need to be looking afresh at the lifestyles, at health promotion, at access to healthcare for people with developmental disabilities to try to address some of the risks for ill health and therefore of the ill health that's likely to increase the severity of COVID-19 if it's experienced. The last two bullets on this slide, I want to discuss a little bit as well. People with developmental disabilities, it's not that no person with a developmental disability gets married or forms a partnership or has children, but it's actually it's a relatively small number. That being the case, as you think about social networks, as you think about being isolated or in quarantine, so I'm sitting in my own house because I'm working remotely, but I'm sitting here with my wife and with my son. So if I didn't have a wife and I didn't have a son, I'd be sitting here alone. And the reality for people with developmental disabilities is that when we have to isolate ourselves, when we're in quarantine, it's more likely that we will not have people who are very close to us. Granted, if people are living in a group home or another community residence, they'll be there with the peers that they have always lived with. But many people will not have access to people who are really important to them. And they're likely to have smaller numbers of people who they would consider as really important. The other thing is and this is another area where health and healthcare for people with developmental disabilities gets limited, is that we have a situation where a person with a developmental disability, when they go to see a physician or another healthcare provider, it's likely that their health visit will take longer. But the health provider is most likely to be paid under Medicaid. So we end up with a situation where health visits take longer and providers are paid less than they would be for a similar visit with a different kind of insurance. And so we also have to be concerned that that not become a barrier to doing comprehensive assessments and ensuring that proper care is being provided to people with developmental disabilities. As we seek to deal with COVID-19, I'm also concerned about what's happening now where we are relying much more upon phone calls and telehealth technology with a population that may be nonverbal and may be presenting with a lot of characteristics that are difficult to discern from health symptoms, and whether or not they are receiving the kind of attention that they really need during this pandemic. So I think another piece for us as we think about the future is that as we develop telehealth type interventions, that we be thinking about how they may be adapted or what additional pieces are needed so that people with developmental disabilities receive the kind of health screening and health care that they need and that they deserve. So again, sort of returning to COVID-19 and to think about what places people with developmental disabilities more at risk. I think about the issue that cognitive impairment often gets in the way of self-protection. The things that we are all being asked to do to reduce the likelihood of infection are likely to be difficult for a person with a developmental disability. You have to understand the risk of the disease, and you have to remember to be careful. And for people with cognitive impairments, that's not the easiest thing to do. In terms of hygiene, I feel as though in the opening week of shutdowns, everybody was washing their hands, just with following all the CDC guidelines. But since then, sometimes you forget. But that's a real problem with someone with a significant cognitive impairment. I decide that I understand what COVID-19 may represent. I'm going to do this. I make the decision that I'm going to be much more serious about washing my hands, both in terms of how long I do it for and how frequently I do it. If I am someone who doesn't fully understand or has difficulty with memory, then I'm not going to do it as often as everyone else. There's a function, we talk about executive function within the brain that helps us to connect all of that information and make those decisions and build those habits. And people with a developmental disability may not be as able to do that. This whole idea of covering coughs, and I didn't cough deliberately so that I could go back to it, but nevertheless, during the course of this presentation, I did cough. And so what did I do? I coughed into my arm. It was an automatic gesture. It was an automatic protective approach. And I'm sitting here by myself in this particular room, but I still did it because I don't want to make the mistake of not doing it at another time when there are people around. So covering coughs requires vigilance. And again, it requires that executive function ability to put all those pieces together and to protect myself and everyone else. Again, can be very difficult for a person with a developmental disability. Social distancing or physical distancing. And in fact, I would sort of argue that, I don't want to complicate language, but I think that it is really about physical distancing, that 6 feet apart. It is about, I think we've been tending to call it social distancing because we want people to understand that they should distance themselves from other people. But we are very social people. And as this continues week on week, many of us are experiencing it difficult, that I can see people, but I can't touch them, I can't hug them, I can't get the kinds of experience of being cared for by other people that are a routine part of my life. Again, for people with a developmental disability, it's likely that relationships are a little bit more tactile than is true for the general population. And that, again, when you have a limited social network, not being able to touch, to hug, is experienced as a real deficit, a real deprivation by many people with developmental disabilities. So it's likely that these things that we are all being encouraged to do are being experienced as more difficult. And if the response of the rest of us, of people who are providing care or other people in the community, is to get really upset when a person with a developmental disability rushes up and grabs our hand, that only makes the situation harder for the person with a developmental disability. So that's on that piece of it. But the other piece that we're really encouraging people to do is to be vigilant about the symptoms of COVID-19. And for people with developmental disability, they may not recognize that those are symptoms. I've always coughed. Is that what you call it, a cough? And also that they may simply just not mention that something happened, that I'm coughing, that I'm sneezing a lot more than I usually do, that I think I'm running a fever. That idea of running a fever is actually, it's a pretty complex set of thoughts that, okay, I'm warm, but what does that mean? It means it's of concern because I'm warmer than I should be. Well, what if I don't know what temperature I should be? How do I know that I'm warmer? So that a person with a developmental disability may not report the symptoms. So therefore, all of us around that person, we need to be more vigilant on their behalf. And then the last thing I'll say is that once someone isn't infected, those cognitive limitations can contribute to disease spread. I don't know to stay away from people. I don't know to report my symptoms. And so those are things that, again, place people with a developmental disability more at risk. So there's not a lot of statistics so far for people with a developmental disability. So it happened last week, the New York Times on April 9th had an article where they interviewed a number of providers for people with developmental disabilities in New York City and the surrounding area. And in that article, they did report some statistics from the Office of People with Developmental Disabilities in New York. So that agency is responsible for 140,000 people with developmental disabilities in New York. And as of the 8th of April, 1,100 had tested positive and 105 had died. So you see a lot of statistics being reported, and we tend to look at the big numbers and as whether those big numbers are going up or are going down. Most recently, we've been paying attention to what's happening for particular groups within those big numbers. We're looking at nursing homes, we're looking at people over 70, and just now we're starting to look at people with developmental disabilities. So the death rate for people with developmental disabilities is higher than for the general population, but it's similar to some of the rates that are being reported in nursing homes. So this is one snapshot reported in the press as opposed to reported in a peer-reviewed journal article, but it's coming from a reliable source. It's coming from the state of New York's Office for People with Developmental Disabilities. So clearly we need to be gathering more information. We need to be looking at this picture further, but it does suggest that all of the risks that I talked about are translating into people not only getting COVID-19, but that there are likely to be a higher rate of severe illness and even of mortality. So given that information, we should be looking to do as many things as we can to help people with a developmental disability avoid COVID-19 infection. We need to be, and again, I say we need to be because people are going to need some help. That some of the things that we are all starting to do routinely are not something that is as easy for a person with a developmental disability. So we need to be thinking about how we ensure that they're not exposed unnecessarily to gatherings, public transportation, or unnecessary visitors. Even if people are not stating that they're infected or not appearing to show symptoms of being infected, they may still be able to spread COVID-19. This is something that we're really learning much more about now. But I think too about who is it that's providing care for the person with a developmental disability. Is it a family member? Is it staff, for example, in a group home? Those individuals need to be extra careful about their own health and their own safety in terms of COVID-19. in terms of their interactions with others, but also to pay a little bit more attention to their interactions with the person with a developmental disability, that they're not unintentionally infecting or they're not being infected by the person with a developmental disability. When someone has a very small social network, to lose you, my mother, my sister, my favorite staff member, that's not going to be helpful to my experience of COVID-19. We need to emphasize all the same things that we are all being asked to do. And I just put up the image from CDC, sort of, really all of these steps are things that we all need to be doing. We need to be looking at proper hand washing hygiene, but simply saying it isn't going to be enough. There's got to be reminders. There's got to be modeling. If you tell me that I have to stand, as the CDC direction says, that I have to wash my hands often with soap and water for at least 20 seconds, and you don't do that yourself, then I don't know why I, as a person with a developmental disability, need to do it. So we all need to be setting that example. We need to be covering coughs and encouraging the person to cover coughs and to realize that this is not an instruction that we're likely to be giving somebody once. We're going to have to give it multiple times. We need to be thinking about self-quarantining if necessary, and I'll talk about that in a moment. It's about some of the challenges that are there. We need to be looking at disinfecting surfaces and doing that frequently, because the person is not going, many times, is not going to be able to do that for themselves. And we have to be encouraging people to stay home. That is one of the best protections. So the question comes up as to whether or not people with a developmental disability should be tested for COVID-19. This is actually, it's an interesting issue. So my answer is yes, that the guidance should be the same for people with a developmental disability as for everyone else. That we should be looking to see if there's symptoms or evidence that the person is being exposed. We should be notifying their primary care physician, recognizing that that probably will mean a virtual screening. But let's not agree to either a test or a diagnosis because, well, they have a developmental disability, therefore they probably do have COVID-19. Nobody probably does. It's on the basis of having a developmental disability, but their probability is perhaps is higher because of other chronic conditions. And we have to be thinking about, when we're talking about if, for example, someone is living with 3 or 4 other people, to also think about and report whether other people in that home are displaying symptoms. This is what we mean when we talk about clusters forming. And certainly the reports that we're seeing for nursing homes, for example, where much larger numbers are together, we're seeing these clusters develop of large numbers of people, whether it's the nursing home residents themselves or the staff having symptoms. We need to be paying the same attention for people with developmental disabilities. If the person displays symptoms, the test is requested, the person should be isolated and their symptoms monitored while awaiting test results, the same as all of us. Now, in terms of testing, I'll raise one other concern. Most of the testing that's currently occurring is actually uncomfortable in the way in which it's administered. We're looking at a whole series of other kinds of tests that will be easier to do, less intrusive. But right now, it's a relatively intrusive test. And a person with a developmental disability, again, if they don't understand what's going on, and someone comes at them wanting to shove, and that's how they'll perceive it, wanting to shove something up their nose, they're probably not going to be agreeable to it. So thinking about sort of how we explain the procedure is really important. I actually think it's really important for all of us, but I'm going to emphasize that it's particularly important for a person with a developmental disability. So then I think about the whole issue that then if COVID-19 is confirmed, what are some of the things that we need to be doing? Been a lot of attention publicly around PPE, the personal protective equipment, the shortages that have been experienced, and the emphasis upon making as much of that material available to hospitals where people are experiencing very serious illness, and where we are rightly concerned about the protection of the healthcare staff that we are relying upon. So the availability of PPE is actually quite limited beyond those kinds of formal hospital settings. I think this is something we're going to have to think about for the future. Should every supervised residence for people with a developmental disability or for other supervised groups have allocated PPE? What about families caring at home? Should they have access to PPE? I think we're going to have to look at all of that. But there's another side to this issue as well. We have, as a field in developmental disabilities, we have emphasized creating environments that are home-like, and sort of someone coming in a gown with gloves, with a mask on, with something covering their head, probably as well. That's sort of, it's not our picture of what home-like is. It's actually a pretty scary experience for people with developmental disabilities. It is for most this time. And so we really need to look at, again, sort of how do we explain all of this? How do we reassure people? How do we prepare people for some of these realities? The other thing that I think about is that we need to be identifying and training the alternate caregiver. What if that favorite staff person, what if that family member is infected with COVID-19 and is no longer able to provide care? Who's going to do it? It shouldn't be a panic. It should be something that we've prepared for. So right now, because COVID-19 hit us unexpectedly and we weren't well prepared for it, some of the responses are in a panic. But what's going to happen the next time? What are we going to learn from this that we will apply the next time? Let's think about that if someone needs to be isolated, that isolation is about being physically separate, but it's not about being alone. How do we do that? How do we manage within our own homes? Let's think about, okay, I'm not leaving the house, but what are the activities? What are the things that I really like? How do I access those? How can I do things that I enjoy? Please explain to me what's going on. And there are actually some really great easy read or plain read materials that explain this disease for people with developmental disabilities. Let's think about virtual visits or through the window visits. And I have a picture here of a gentleman who's sitting outside and he's on the phone and he's talking to his family member who's just to the other side of the window. We should be looking at those kinds of interventions as well for people with developmental disabilities. And clean, clean, clean. We've got to keep surfaces clean. We've got to really emphasize that throughout the homes, because other people are at risk if there is more than the one person in the home. And I put up here information on the CDC guidelines for cleaning in community facilities. So then we have to think about what is the best care pathway. Most people, as I said, will have mild symptoms and they'll recover. A small percentage will die, including people with developmental disabilities. And when we see multiple health concerns, on the one hand, that's more likely to encourage transfer to hospital, but it may also mean poorer outcomes from transfer to hospital. And for people with developmental disabilities, we have a very strong emphasis again on familiar staff, familiar family, familiar environments. That we probably should be thinking about admission to hospital, not as the first line of defense, but as the last line of defense. So again, sort of what can we do to increase the likelihood that someone is able to stay at home? So I think there are things that we can look at to sort of think about Is it possible to maintain isolation or quarantine? Does a person have their own room? They access the things they enjoy? I always think about that, am I just going to spend my life in my bedroom? Or is there another part of the house that I can be? I'm a great believer in porches, in gardens, that we have a controlled space, but I can at least walk around a little bit. To think about, again, sort of, is there another space that might be better suited for isolation? I've talked with some providers, large providers, and they are looking at different homes that they have available, small settings that they have available, and can those be set up to support isolation? And that perhaps the person is transferred there. There's a lot of issues with that in terms of increasing concerns for the person because they're moving away from a familiar environment. But it might be a better choice than going into hospital. And then sort of really the strong emphasis on virtual and through the window visits so that the person can feel reassured. But again, if someone's in a home where there are other people and their presence with infection may be placing them at risk, we do have to think about, what are the least restrictive measures that are available? And perhaps we might want to think about, would the person benefit from being moved somewhere else? And I say that with some hesitation because within our field, we have been really concerned about what happens to people with developmental disabilities when they move somewhere else. So the information that's coming out on what happens when people are placed in ICUs with severe COVID-19 it's concerning. I looked for different data. This is actually from the UK, from their National Audit and Research Center, because I wanted to have data that was from a reputable source. And you'll see from the data here that when people are admitted to ICUs, when they're placed on ventilators, there's a high mortality rate. And not sure if you can see the picture on the bottom right. They notice that's posted on the window about no visitors. And we are very concerned about people with developmental disabilities going into hospitals and there being nobody around them that they know. And what that means for their well-being, for their quality of life, and also actually what that means for their health and their ability to survive this. We're concerned too, in the other picture, you see people fully gowned up and wearing masks. What that means for a person with a developmental disability, that there's nobody that they recognize. And it's a little frightening. So there are some changes happening. In New York State, just in the last week, they introduced a new requirement that hospitals are required to permit a patient support person at the patient bedside if it's a person with an intellectual or developmental disability or someone with dementia. I think we should be advocating for that everywhere. That if someone has to go into hospital who has a cognitive impairment, like a developmental disability, that they should have access to a support person if someone's willing to play that role. The other thing is a form that has just come out, and actually a social worker at SUNY Stony Brook was very instrumental at developing this, where we develop information that can accompany the person. Because if they're largely nonverbal or they're confused, how will people know who they are and how to present things in ways in which they'll be able to cooperate with care? And so this form has been developed. So again, we should be looking at doing similar things in other states. But we are really concerned about people with developmental disabilities and the potential that they will receive less care and the potential that they will be seen as not worthy of care, perhaps, because other people are seen as of a higher priority. And so there's been a lot of advocacy groups have been raising this issue. What I've put up here on this slide is that there was a Congressional Research Service report put out in 2008. that dealt with the issue of pandemics that a number of people are referencing as saying that it places people with developmental disabilities at risk. And it talked about if there was a pandemic, if there was issues around shortages of vaccines or shortages of beds, or as we've been talking about in this pandemic, shortages of ventilators, what happens to the protections of things like the Americans with Disabilities Act and Section 504? And this report talked about that there may be some circumstances where because the vaccine is not likely to be effective for a person, or because some of the other medical treatments may not have a very high chance of being successful, that perhaps this legislation, it would not be a violation of this legislation if the person was denied a vaccine or denied the treatment. It's not saying that rationing or making those choices on the basis of a particular category, like having a developmental disability, is permitted. It laid out that those decisions should be made on an individual basis in terms of what it means for that individual and their potential to recover. But nevertheless, it's concerning because if people are not able to speak for themselves, if there's not someone there to advocate for them, if there isn't the kind of information like on the form that I just showed you available, that if we're making tough decisions in exceptional circumstances, will people with developmental disabilities necessarily, well, it's not a necessity, but just will people with developmental disabilities end up not receiving the level of care that they deserve? And so I think about it as the level of care that people deserve. And it's incumbent upon us to, again, sort of push for those changes in regulations to ensure that the right information is available and that the right care is available for people with developmental disabilities. In terms of end-of-life issues, I'm always struck by over the last 20, 30 years, there's been a really strong emphasis around the development of advanced directives, of building living wills. But we still need to do so much more about that for people with developmental disabilities. And to realize that many people with developmental disabilities actually have a lot of thoughts about how they would like to live and die. What's acceptable and what's not acceptable to them. We need to be thinking about the designation of an informed surrogate decision maker when people are not able to speak for themselves. We need to be thinking about that end of life is also about potential loss of caregivers and how we support a person who loses a caregiver. And we should also be looking at linking with hospice and with palliative care, and ensuring that they have an understanding of the person, understanding of the needs of people with developmental disabilities, not when people are at the very end stage of life, but that is part of their understanding. Palliative care should be beginning so much sooner. It won't happen for people with developmental disabilities if we don't develop those linkages. So within the developmental disabilities field, we've one of the things that sort of has been concerning in our field is that we have a tendency not to tell people with developmental disabilities how serious things are. And so we've been trying to change that. And we talk about the breaking of bad news. And so there's this ARC model or ARCH model that is being developed. Ask, repeat and clarify, check the level of understanding, and help the person express feelings. One of the things that happens a lot for people with developmental disabilities is that others think they should protect them from the tough things in life. But many people with developmental disabilities, just like the rest of us, want to know what's going on. The other thing that we do sometimes is we don't want people to be upset. But actually, we need to express our feelings, including our upset, particularly when we're dealing with something like COVID-19. And so I would encourage people to explore the ARCH model and the materials that are available related to it, and to be thinking about advanced directives and really advanced care planning for people with developmental disabilities. We should all be doing that for ourselves. So there's actually a lot of resources that have been developed. The National Association for Direct Service Professionals has put out a 3-part series on the role of the direct service professional and the coronavirus epidemic. There are a number of fact sheets and toolkits that have been put out. I highlighted here the Q&A on COVID-19 and Down syndrome. But I provided you with links to probably the 4 organizations that have the most comprehensive information, and that you'll be able to find lots of different pieces that speak to different aspects of this issue. The National Association of Direct Service Professionals, on their website as well, there's a resource on talking to people with intellectual disabilities about COVID-19. There's some easy to read materials, some posters that different groups have put together. And there's a poster that they call it Coronavirus 101. These are all things that are free, they're downloadable, and there's lots of other resources. I'm always concerned for caregivers, because I think caregivers are really critical for all of us, but particularly for people with developmental disabilities. Again, the National Association for Direct Service Professionals has developed this 10-minute meditation video that's on their website, and it's great for family caregivers too. There's a group of family caregivers who operate virtual support groups and run a regular newsletter. And so I highlighted their Set Yourself Up for Success During Difficult Times handout. If you go to the National Down Syndrome Society website, that's ndss.org, it's right there, you'll find these materials and an awful lot more. So I'm going to end there, but this, as I said, it's one of a series of webinars that we're doing. We certainly, if you have questions that occur to you afterwards, go to the website and pose those questions, and I promise to get back to you. But what the COVID-19 pandemic has highlighted is the importance of public health and the relevance of our work. It's also been a time that has been really difficult for our students. And it's a time when our faculty and our researchers are really looking at new ways of addressing this problem and related problems. So we hope that you would consider giving towards the work that's being doing here, but I'm happy to do this. And please, make people aware of this. There's no expectation that you give. It would be great if you would. We're grateful and very proud of our alumni who are serving on the front lines of this pandemic. And we do this work, these webinars, as part of our giving back to our alumni and to everyone on the front lines. And it's our hope that every member of the Temple community and their families remains healthy and remains safe. So again, we have a lot of information that's available. Please go to our coronavirus resource page, and you'll see the URL here. So we're hopeful that much progress is going to be made in the weeks ahead, and that we will be looking at a very different situation soon. But I think too, as I've said, we also have to be prepared that there may be subsequent waves, other types of viruses. And so we should be thinking not just about what we're going to do today, but what are we going to do for the future? And in terms of, I'll open it up now for questions. And from the chat, I got a couple of questions that I would just like to address. Someone raised the whole issue, and I'm really not surprised to see this, the whole issue of PPE. Why is that not available for families? Why is it not available in the places where people with developmental disabilities are living? And you know, this is something that came on relatively suddenly, and which we were not well prepared for. Yes, there were stockpiles of this material, but we were not prepared for how quickly this spread, or how totally this consumed supplies. As I said, we need to be doing a better job for the future. I think we need to be thinking about not just about national or state stockpiles. I don't want to encourage another run on hand sanitizer and toilet paper, but I think that when this particular outbreak passes, we should have a conversation about the availability of PPE and where it needs to be and how it will be accessed if something like this happens in the future. Someone also asked about, and I had addressed this somewhat, are people with developmental disabilities not receiving services, and particularly health services, because of longstanding stigma? I would hope that that's not true. I think that we've worked very hard to try to overcome some of those stigmas. I think that if there is still some reluctance to serve people with developmental disabilities, it's about a lack of information, it's about misunderstanding, and it's about not seeing the person as an individual rather than as a person with a developmental disability. I'm hoping things like what I've just done and the information that's available on the different websites that I referenced, those resources really are about changing that misperception of people with developmental disabilities. Yeah, for me, I want people to be clear that there are people with developmental disabilities that are at increased risk, both of acquiring COVID-19 and of having poor outcomes. And that's because of the chronic conditions that they have. It's not because they have a developmental disability. But I also want people to be aware that most people do not have a severe case of COVID-19. And you know, there are things that we can do, but that we have to be more thoughtful and more planful. And to think about this as we're coming through this particular experience of the pandemic. Are we just going to wait for it to happen again? Or are we going to be better prepared the next time? I hope we'll be better prepared. So I want to thank you for participating in this webinar.